It's a pleasure today just to give you a very short talk around one slide to discuss some of the themes for patients living with primary biliary cholangitis and primary sclerosing cholangitis, two diseases amongst the family of rare autoimmune liver diseases that people across the world live with. I look after patients with these diseases, and they come to see us hoping to understand why they got the disease, why they feel the way they do, and what the best treatments are to prevent end-stage liver disease and improve their quality of life. These diseases are really part of a big family of autoimmune injury to either the liver cell or the bile duct. In this family, we have four silos of diseases. The main silos are PBC, autoimmune hepatitis, and primary sclerosing cholangitis. Trying to understand why someone develops these diseases is very important to address the unmet needs of our patients. This is because our patients currently living with these diseases, PBC and PSC in particular, do not have curative treatments, and the treatments may not always improve their quality of life. As we understand it, the reason you develop these diseases relates to the genes in your genome, how the genes in certain cells function, and environmental triggers that you might be exposed to, such as smoking, drugs, industrial dust and solvent exposure, pollutants, etc. On top of that, there is then an interaction, we presume, with the bugs in your bowel. What this means is that all of these factors come together in an individual, and then there is a triggering of a process that leads to damage to either your bile ducts or your liver cells, or both. When this happens, our patients may not feel well, including fatigue, pain, itch, and if we do not develop appropriate treatments for them, are at risk of what we call end-stage liver disease. By that, I mean the development of cirrhosis and the complications of cirrhosis. In some diseases, particularly PSC, on top of this, there is a risk of development of cancer. So where we stand at the moment is we have this family of diseases where we don't know the exact cause. And because we don't have an exact cause, we don't have an exact treatment. This means our patients continue to have impaired quality and quantity of life. However, we are working very hard to improve this, and we have worked very hard with patients, clinician colleagues, industry, and regulators to develop new treatments for these diseases, which we hope will impact positively. PBC, the most common of the autoimmune liver diseases, affecting about 1 per 100,000 people per year, is a female predominant disease that is very autoimmune. There are classical autoantibodies. Patients who don't have control of their disease with current treatments with ursodeoxycholic acid benefit from treatment with drugs such as obeticholic acid and other fibric acid-like drugs that are currently in clinical trials or used off-label. We've learned by working together that if we target normalization of their liver blood tests, we can significantly improve their outcome. What this means is there are a number of phase 3 clinical trials for patients with PBC, and in the future there will be a whole range of drugs to treat patients with PBC. On top of this, much effort has been given to developing treatments for symptoms in PBC. These include particularly itch, and there are a number of clinical trials ongoing around the world looking to develop drugs that will improve patients' experience of itch, a very distressing symptom that leads to loss of sleep and fatigue. Drugs such as the IBAT inhibitors are currently under investigation. The other disease with a very large unmet need is primary sclerosing cholangitis. This disease, in contrast to PBC, affects all ages, is more prevalent in men, and in particular has a tight association with inflammatory bowel disease. Unfortunately, at present, primary sclerosing cholangitis does not have effective medical treatments. We have symptom control, use of ERCP, and our patients ultimately rely on liver transplantation. This means there is an acute unmet need for patients living with PSC, and there is significant effort globally for the development of new drugs. Again, the therapies that we are targeting, either alone or in combination, are trying to reduce inflammation in the bile ducts and inflammation in the liver cells. And there are a number of phase 2 and phase 3 trials that are ongoing or to be reported. This underpins a lot of work for the basic science, which has also given suggestions as to where to target treatments for the future. Symptoms are also very important for patients living with PSC. And again, itch in particular is an unmet need, and a number of agents are under investigation for the treatment of itch. What I hope you've learned just from listening today to this very high overview of autoimmune liver diseases is that the community of clinicians who look after these patients are committed to developing new treatments for patients. And to develop new treatments for patients, we need to have better science, which understands why people develop these diseases. We need better collaboration, which tells us what happens to our patients over time with these diseases. And we need approaches to identify which patients and when should receive new treatments. We then need ongoing support, which I believe we have from patients, to take part in these research efforts so that in the future we can develop better treatments. The panacea is that we control these diseases much better and patients have improved quality and quantity of life. What we have witnessed in primary biliary cholangitis over the last 10 years is a significant improvement in the management of the disease, nevertheless, with goals for greater aspirational care still existing. This means for patients living with PSC, we can express the same aims, and we hope that in the future, we'll be able to use our scientific understanding of the diseases to give treatments that improve quality and quantity of life. So despite the fact that these diseases are rare, they remain impactful, they remain important, and there remains significant advocacy amongst patients and clinicians to change the outcomes for our patients living with these diseases. Thank you.